Hello, good morning, good evening. My name is Wasihan Nicodemus, Dr. Nicodemus. Today we're going to talk about cannabis. Why? Well, you will see. According to WHO, 200 million people, or 4% of the world population, use marijuana or cannabis, making it the world's most widely cultivated, trafficked, and abused substances. Cannabis is known to have behavioral effects, including feeling of euphoria, relaxation, altered perception of time, lack of concentration, and impaired learning. Let's talk about pharmacology. As a pharmacist, we focus on how a medication or a substance exerts its effect. There are two known cannabinoid receptors in a human body: cannabinoid 1 and cannabinoid 2. Cannabinoid 1 receptor is found in the central nervous system, which inhibits neurotransmitters such as norepinephrine and dopamine. The second cannabinoid receptor 2 is found in the immune system, which regulates the immune response and inflammatory reaction, which has a big role in infection. THC has a similar structure with the natural chemical named Anandamide, which is also cannabinoid 1 receptor, CB1 receptor. So this similarity in structure allows the body to recognize THC and alter the normal brain communication. So THC is able to attach to this receptor in the neurons in this brain area and activate them, disrupting various mental and physical functions, and influence pleasure, concentration, memory, thinking, movement, coordination, and time perception. What are these neurotransmitters that influence our body function, mental and physical functions? Neurotransmitters are chemical messengers that our body cannot live without. This neurotransmitter's job is to carry chemical signals or messages from one neuron to the next target cell. That next target cell can be a muscle. In other words, nerves are involved in everything we do, including what we think and feel. Let's talk about norepinephrine. Norepinephrine is one of the neurotransmitters that THC inhibits. So norepinephrine increases blood pressure and heart rate. It is most widely known for its effect on alertness, arousal, decision making, attention, and focus. And dopamine, the other neurotransmitter, dopamine plays a role in our body reward system, which includes feeling pleasure, achieving heightened arousal, and learning. Dopamine also helps with focus, concentration, sleep, mood, and time perception. So when it comes to pharmacokinetics, the movement of the drug in our body, many people after using marijuana or cannabis experience euphoria and pleasure. And other common effects which may vary dramatically among different people. It includes heightened sensory perception, example like brighter color, laughter, alter perception of time, and increased appetite. So pleasant experience with marijuana is by no means universal. And instead of relaxation and euphoria, some people may experience panic, fear, and distress. Let's talk about pharmacokinetics, which is the drug movement in our body. When marijuana is smoked, it passes from the lung into the bloodstream, which rapidly carries them throughout the body to the brain. The onset of psychoactive effect occurs rapidly within 15 to 30 minutes, and it lasts us about 4 hours. When compared with inhalation or smoking, cannabis ingestion has a delayed psychoactive effect within 30 minutes up to 3 hours, and it lasts about 12 hours. The clinical effect lasts up to 12 hours. The length of the time this chemical lasts in our body depends on many factors. How much body fat a person has, how much and how long a person consumed the cannabis, and also, of course, the sensitivity of the drug test. For someone who smokes cannabis or marijuana for the first time, the test can detect up to 3 days. And someone who smokes cannabis up to three to 4 days per week, the detection window is 5 to 7 days. For the people who smoke cannabis once a day or more, the test may detect marijuana for 30 days or more. There are many different tests. Urine test can detect cannabis in the urine approximately within 3 to 30 days after use. Saliva test can detect cannabis approximately 24 hours after use. So hair test is the most sensitive one, detecting THC for up to 90 days after use. The last one is blood tests, which can detect up to 3 to 4 days after use. Cannabis is metabolized by liver and excreted up to 65% of it through feces and up to 20% urine. Also difficult to measure, but the elimination half-life is up to 35 hours. What is half-life anyways, right? Half-life is our body natural way of detoxing drug or substance, which is 50%. It's kind of complicated. Elimination half-life is the length of the time required for the concentration of a drug decreased to half of its starting dose. After 4 to 5 half-life, a drug concentration will be clinically irrelevant. So that means here the half-life is 35 hours. So you need 5 times of those, 4 to 5 times of 35 hours to eliminate cannabis from our body system. Let's talk about drug interaction. So if you are taking marijuana, you should talk to your pharmacist. There are so many drugs that interact and then reduce the medication you are taking, reduce the effect of the medication you're taking, or the marijuana itself, the drug you may be taking could reduce the effect of or increase the effect of the marijuana you're taking. So CBD or marijuana can increase the concentration of the drug you're taking for AFib, for example, digoxin, or if you are taking cyclosporin for transplant, if you are taking warfarin for a blood thinner, atrial fibrillation, if you are taking colchicine for gout. If you are taking citalopram for depression, those will be increased, their concentration will increase by marijuana. Some antibiotics like antifungal, clarithromycin may increase the toxicity of cannabis. So there are many different formulations of cannabis or THC. So you have delta 8 THC, delta 9 THC, and delta 10 THC, but the most psychoactive one is the delta 9 THC. That's the most psychoactive THC. Of course, there are synthetic cannabis out there. They have the same effect as the natural cannabis, but they may cause the most life-threatening side effects. These days, marijuana is approved for a recreational purpose or recreational use. And from all of the THC formulations, cannabis sativa is the most commonly used for recreational purpose. So cannabis sativa contains over 500 compounds and known 60 cannabinoid product. Of this, THC is the most psychoactive and responsible for most of the intoxication. Medicinal cannabis is commonly used for pain, nausea, and then seizure. Based on the clinical trial, the side effects of this FDA-approved cannabis are so vomiting, fatigue, decreased appetite, somnolence, and diarrhea. What are the clinical manifestations? How do you know when you see it on someone? The clinical manifestation of acute cannabis intoxication varies according to use. Recreational cannabis intake to achieve psychoactive effect can often result in adverse effect because there is no clear demarcation between doses that achieve a symptom desired by the cannabis user and toxic effect. Okay, since non-FDA approved cannabis products are unregulated, other ingredients may be available, may be included, may be in this product, which may contribute to the cause of more adverse effect. One study found that people who frequently smoke marijuana had more hospital visits with respiratory problems than those who doesn't smoke marijuana. So THC crosses the placenta. If a pregnant woman smokes marijuana, it passes through the placenta and the baby can get up to 10 to 20% of what the mama or what the mother ingested. There are no human research connecting marijuana to maternal effect, but there is no human research connecting marijuana use to the chance of miscarriage. Although animal study indicate that the risk of miscarriage increases if marijuana used early in pregnancy. That was animal study. Limited data demonstrate that THC can accumulate in the breast milk, peaking at 4 hours after maternal smoking. It can also be detected in the breast milk after 6 days of maternal cannabis use. The American College of Obstetricians and Gynecologists recommend against the use of marijuana while trying to get pregnant. So dopamine plays in our body reward system, which includes feeling pleasure, achieving heightened arousal, and learning, right? Dopamine also helps with focus, concentration, memory, sleep, mood, and motivation. THC stimulates neurons in the rewarding system to release the signaling chemical dopamine, at the level higher than naturally observed in response to natural rewarding stimuli. The surge of this dopamine, it teaches the brain to repeat that helping account for marijuana addictive property. I hope you enjoyed today's presentation, and I will see you next time. And then again, if you enjoyed my presentation, make sure you like and subscribe so that you get more or get notified whenever I bring in a new presentation. You have a good day or good night. Bye. See you.